Nursing 474, Poverty and Homelessness. The weekly learning objectives include use evidence-based practices to care for vulnerable populations, choose strategies that can be used by nurses to improve the health status and eliminate health disparities of vulnerable populations, including governmental, community-based, and private programs, and the last one is produce a resource list which could be used by vulnerable populations. The concept of poverty. Individual perceptions of poverty in poor people are rooted in social, political, cultural, and environmental factors. The personal beliefs, knowledge, and values that one holds can influence the understanding of the concept of poverty. Personal beliefs are ideas about the world that an individual believes to be true. American attitudes toward persons are influenced by socio-cultural values of personal responsibility, individual autonomy, and personal accountability. Defining and understanding poverty. The official poverty measure in the United States is a specific dollar amount that varies by family size but is consistent across most of the country. In 2007, more than 37.3 million persons had incomes below the federal poverty level. 18% of American children live in poverty. Social and cultural definitions of poverty. For years, income level has been used as the key criterion that determines whether someone is poor. Although it remains the measure of choice, poverty is not adequately defined solely by income level. Poverty refers to having insufficient financial resources to meet basic living expenses such as food, shelter, clothing, transportation, and medical care. Political dimensions. Poverty involves a lack of control over critical resources needed to function effectively in society. A historical and political review reveals changing attitudes and an interest in the plight of the poor. The federal government uses two terms to discuss poverty: the Poverty Threshold Guidelines and the Federal Poverty Income Guidelines. The former is used for statistical purposes, and the latter, which is updated annually, is used to determine financial eligibility for assistance and services such as temporary assistance to needy families, Medicaid, food stamps, women, infants, and children, and Head Start. The causes of poverty are complex and interrelated. Although the number of older adults living in poverty has declined, the number of women and children living in poverty has increased. Factors that affect the growing number of poor are decreased earning, increased unemployment rate, changes in the labor force, increase in female-headed households, inadequate education and job skills, inadequate anti-poverty programs, inadequate welfare benefits, weak enforcement of child support statutes, dwindling Social Security payments to children, trade deficits, and outsourcing of American jobs. Lack of access to health care benefits compounds the effects of poverty on health. Poverty and health. Effect across the lifespan. Poverty directly affects health and well-being. Persons living in poverty and near poverty have higher rates of chronic illness, higher infant mortality and morbidity rates, shorter life expectancy, more complex health problems, and more complications and physical limitations caused by chronic disease. Poverty in women of childbearing age. Women living in poverty have lower levels of physical functioning as well as higher reported levels of body discomfort than women in higher socioeconomic groups. Children and poverty. The poverty rate for children is higher than any other age group. Poverty among African Americans and Hispanic children is more than 3 times that of white non-Hispanic children. Poverty among children has increased in all racial and ethnic groups as well as in all urban and rural geographical areas. Deadbeat parents. Current child support policies are designed to provide financial security to children, prevent single-parent families from entering the welfare system, help single-parent families get off welfare as quickly as possible, and decrease welfare expenditures. Individual states are responsible for locating non-supporting custodial parents, establishing paternity, and enforcing financial responsibility. There are many criticisms of this system. Also, the number of custodial single fathers is increasing. In 2007, an estimated 9.7% of older adults, that's 65 years and older, lived in poverty. The percentage of elderly persons living in poverty has decreased as a result of policy changes and improvements in Social Security and supplemental Social Security income. The community in poverty. Poverty affects both urban and rural communities. Characteristics of poor neighborhoods include more minority residents, more single-parent families, high risk rates of unemployment, lower wage rates, higher rates of morbidity and mortality. Understanding the concept of homelessness. Nurses who work with the homeless clients need to understand homelessness from a conceptual perspective. They must be aware of the causes and effects of this public health problem and need to be aware of their own beliefs and values about homelessness. Clients' perceptions of homelessness. Those who live on the street are the poorest of the poor and often perceived by those more fortunate as faceless, nameless, invisible, inaudible entities. As nurses begin to work with homeless groups and get to know their clients by name, they can appreciate the humanity of the homeless clients and begin to build therapeutic relationships. The effects of homelessness on health. Homelessness is correlated with poor health outcomes. The homeless suffer a significant greater incidence of acute and chronic illness, AIDS, and trauma. Even though the homeless are at higher risk of physiological problems, homeless persons have greater difficulty accessing healthcare services. Healthcare is usually crisis-oriented and sought in emergency departments. Those who do access healthcare have a difficult time following prescribed regimens. Health problems of the homeless are often directly related to poor access to preventative healthcare services. Facing challenges related to self-care, homeless people usually give lower priority to health promotion and maintenance than obtaining food and shelter. Specific problems include exposure disorders such as hypothermia and heat strokes, infestations, peripheral vascular disease, hypertension, respiratory infections, tuberculosis, AIDS, trauma, and mental illness. Homelessness also affects psychological, social, and spiritual well-being. Homeless pregnant women are at high risk for complex health problems. They have higher rates of sexually transmitted diseases, higher incidences of addiction to drugs and alcohol, poorer nutritional status, and higher incidence of poor birth outcomes than women who are not homeless. And although they are at higher risk, they have less access to prenatal care. The health problems of homeless children, although similar to those of poor children, often have more serious consequences. They have a poorer health status and experience symptoms of more acute illness. Homeless children experience higher levels of anxiety, are significantly more depressed, and are at higher risk for physical and mental health problems than poor children who are not homeless. They are at greater risk for inadequate nutrition, delayed growth and development, failure to thrive, and obesity. They have higher rates of school absenteeism, academic failure, and emotional and behavioral maladjustment. Homeless adolescents living on the streets have greater risk-taking behaviors, poorer health status, and decreased access to health care. They are at greater risk for contracting serious communicable diseases, having unintended pregnancies, and using alcohol and drugs. Homeless older adults are the most vulnerable of the impoverished older adult population. They have lived in long-standing poverty, have few supportive relationships, and are likely to have become homeless as a result of a catastrophic event. They frequently have permanent physical deformities and untreated chronic conditions. Homelessness negativity affects the health of persons across the lifespan. Interventions for the homeless can be assigned to more than one level of prevention. Primary prevention services include affordable housing, housing subsidies, effective job training programs, employer incentives, preventative healthcare services, multi-system case management, birth control services, safe sex education, needle exchange programs, and counseling programs. Secondary prevention services target persons on the verge of homelessness as well as those who are newly homeless using supportive and emergency housing, targeted case management, housing subsidies, soup kitchens and meal sites, and comprehensive physical and mental health services. Tertiary prevention for the homeless include comprehensive case management, physical and mental health services, emergency shelter housing, needle exchange programs, and drug and alcohol treatment. At all these levels, nurses can educate and influence policymakers and legislators to impact public policy and funding for interventions that are effective in assisting the homeless. The role of the nurse. Nurses have a key role in the care of the poor and homeless persons. To be effective, nurses need strong physical and psychosocial assessment skills, current knowledge of available resources, and an ability to convey respect, dignity, and value to each person. Nurses need to be able to work with poor and homeless persons using the following strategies: creating a trusting relationship, showing respect, compassion, and concern, avoiding assumptions, coordinating a network of services and providers, advocating for accessible healthcare services, focusing on prevention, knowing when to walk beside the client and when to encourage the client to walk ahead, and developing a network of support for themselves.